There are various ways to cleanse incoming sensations. One method we'll discuss now, which is versatile and can be used in many contexts, is called neurohacking. Historically, hacking refers to breaking into a safe. Today, we have computer hackers who break into software to steal data or money. Neurohacking is the term we use to illustrate the idea that we can act on the neurobiological networks of perceptions, which then shape emotions, stress responses, and every form of adaptation. If we clean up incoming sensations, the risk analysis, threat evaluation, resource assessment, and so on become more accurate, leading to more coherent and effective adaptive responses. This initial level is a general one, effective across different mechanisms. As we progress in this area, we will examine specific adaptation and development networks on which we will perform targeted works. In this initial phase, we need to help our organism understand exactly what is happening. In meditation and philosophical practices, it has been said for centuries to stay in the present. Here, we facilitate this process at a neurobiological level, helping the sensory organs and the brain perceive what is truly happening in the surrounding world without erroneous predictions, perceptual errors, and other dysfunctions. For a concrete example, people often say, "He looked at me judgmentally, and I got angry." Meditation and, in different ways, some forms of psychotherapy help the person avoid the projection errors. For example, feeling judged and projecting this fear into someone else's gaze, even if it isn't there. Or distinguishing between a thought and reality, the so called diffusion. Or not trigger traumatic memories and their corresponding reaction modes in daily life. Here, with the neurohacking, we act before these processes on the real possibility of seeing someone else's eyes, mouth, and other facial or physical elements realistically. Often, people trigger a response based on a partial perception, a generalized cue, or an ambiguous or unclear stimulus. Sometimes simply because there's a little light, making it hard to distinguish what you see from what you want or fear to see. However, neurohacking techniques do not stop here. They also promote the proper functioning of subsequent mechanisms, whether it's a psychodynamic projection, metacognition in cognitive psychotherapy, or stabilization in emdr. If perceptual mechanisms, sensory dynamics, and checking predictions against reality work well, the brain networks of cognitive and emotional processes can function optimally. So the question is, how can we signal the nervous system to facilitate all this? In neurohacking, the idea is to have a nervous system that somehow resets itself. My image for neurohacking is like pressing the Ctrl-Alt-Delete keys to reset a computer. The computer is frozen, so you press this key combination to restart it. Various devices have a reset button, just as there are combinations of the power button and the volume buttons to restart a frozen phone. Once this reset is done, the system starts over, uninfluenced by what went wrong before. We are not computers, but we do have some ways to create something similar in our organism. Now, let me tell you about what can be done with a hot bath, particularly useful for anxious people or those with PTSD. Once you understand the mechanism, you can develop very different variations. This starting example is long and detailed, useful for seeing all the steps and factors we can act on. Each time, with each specific patient, we can consider simpler and more applicable variations for that case. Consider an anxious patient who, like all anxious people, thinks a lot, too much, and quickly. This thinking gives the illusion of control, but does not truly understand what is emotionally harmful. Some of these patients have severe chronic physical pain or suffering, but do not feel it. They only perceive anxiety, or conversely, they attribute every discomfort to physical sensations and do not notice the mental and emotional components. So, the first step is to clearly explain to the patient how our adaptation mechanisms and emotions work, so they have a clear understanding of what we are about to propose. Then you say, try an experiment today when you go home. And I encourage you to try it multiple times yourself to understand what happens and what you feel. Next, you ask, when we enter a hot room, what generally happens? This engages the patient actively and gets them to reflect on these aspects and their daily experiences. You take their response and elaborate to explain that our system perceives heat. Physically starts vasodilation. The heart beats stronger to maintain blood pressure despite vasodilation, and so on. And what happens in the mind? In these situations, most anxious people feel more anxiety and say, I'm always so anxious, or I feel so anxious today. At this point, our goal is to challenge whether this is truly the case. But we won't do this just by discussing it. We need the person to have a transformative experience. So we explain that the experiment is this. They should heat the bathroom significantly, using a heater if necessary. So it is much warmer than other rooms in the house. If they have a bathtub, they should fill it with very hot water. Safety is crucial. You can recommend using a thermometer and not exceeding 38 degrees Celsius. The maximum temperature of many thermal baths is this, while above 40 degrees can be dangerous. For some people, even 35 degrees can feel very hot. If they are taking a shower, where using a thermometer is difficult, they should keep the temperature just warmer than their ideal temperature. A clinical note: many diabetics have altered perceptions of hot and cold. If this is the case, emphasize the idea of making sure it is sustainable, asking someone to check, or using a thermometer. Let's go back to the experiment. Now, the bathroom is warmer than usual, and the bath is hotter than their ideal temperature. The experiment can begin, and it's useful to proceed gradually. Ask the person to step out of the bathroom and mentally prepare. At this stage, they should start paying attention to their thoughts, emotion, or general sensation. Thoughts of any kind, even if they are thinking about grocery shopping. Emotions or general sensations, even feeling bored or irritated is fine, even though they are not literally emotions, and what they feel in their body. Basic body levels are: how do I feel my muscles in different areas? How is my posture? How is my heart beating? How am I breathing? What do I feel in my stomach or at this moment? And any other detail is fine. Now the person enters the bathroom and let themselves be enveloped by the heat or overwhelmed by it, depending on their individual reactions. Ask the person to proceed step by step. First, close the door, stand there, and take two deep breaths. Physically, the situation is similar to being outside. They are simply standing in a room. What changes is what they see, and most importantly, what their body feels. So the person needs to ask themselves what they feel in their body now. They can describe the immediate sensation. It's hot. The bodily reactions. My heart started beating faster. And more specific sensations like I feel the moisture on my skin, or it feels like my lungs are struggling to breathe. Encourage the person to initially focus only on the body, avoiding emotional correlations. For example, someone might think, I feel terrible, I am suffocating. Explain that these thoughts are normal, but our goal is to isolate and understand what in the body truly creates thoughts and emotions. Therefore, the person should try to concentrate on the reality. It's just a hot room and everything is under control, and attempt to describe the same things from a purely bodily perspective, using the most precise language possible. Wet skin feels different from sticky or feeling sweat droplets. Also, paying attention to changes in posture and movements is very effective, such as noticing my chest struggles to expand, or my eyes keep moving around, or my arms have become immobile. After this initial analysis, the patient should continue observing what they feel, continuously reminding themselves of their location, that everything is under their control, and always refining each sensation. They should always seek connections between what they think, how they think, since heat, like anxiety, often makes thoughts faster and more erratic. Their emotional and affective experiences, trying to understand what truly causes them in that specific moment and context. Occasionally, they can compare what they are experiencing with what was happening just before. For example, if they feel agitated or think with distress about having to do a stressful job later, it's useful to remember that before, outside the bathroom, they either weren't thinking about it or were thinking about it without the same emotional heaviness. Another important mechanism to try now and in subsequent phases is actively improving each aspect of perception. You can change your breathing patterns and observe how physical sensations change and subsequently thoughts and emotions. Conversely, you can use imaginative distraction or hypnotic techniques to modify perceptions and bodily sensations, starting from the mind. Simple measures like schema inversions, which we will cover in Switch Area 5, can be employed, such as externally rotating the shoulders to reduce feelings related to aggression. Everything we have discussed so far can be done in the first phase, when the patient has entered the bathroom and is standing. Then the same procedures can be repeated in subsequent phases. In this case, the next phase is to introduce just one foot into the bathtub, or enter the shower with only the arms or legs getting wet. Pay close attention to the initial reactions. Does the urge to withdraw the foot arise? Are there self critical thoughts such as I'm so stupid for doing this? Or external criticism, like my therapist must be sadistic? Or thoughts related to self image or worth, like I deserve to suffer, or I've endured worse, and so on. The same applies to initial emotional responses like fear or anger. It is essential to listen to the body and understand how much the physical sensations trigger these thoughts and emotions, and how much learned patterns or incorrect anticipations contribute. For example, what happens when moving to a room warmer than the one I was in before? I feel the difference from a bodily change that I usually associate with anxiety, such as tachycardia. But I understand that this time it is actually due to adaptation to the environment. To help us correctly assess these aspects, it is useful to take two breaths. Try to distance ourselves from these things and proceed gradually. For instance, decide to place only one foot in the water and, if necessary, take additional intermediate steps, stopping with the foot halfway, suspended, and identifying what is truly felt, such as the steam rising from the bathtub, and what is being anticipated or amplified, a great heat or a burning sensation that is actually very small. In this phase, besides breathing distraction or various aids, micro adjustments can also be made. For instance, if the urge is to remove the entire foot from the water, one can lift just a centimeter and take the time to feel the change. As you may have guessed, this step is not only useful for refining perception and observing its variations at every moment. This step also serves to experientially live the ability to go beyond instinctive reactions, regain control over one's reactions, and know how to gradually modulate one's behavior. Another step, partially in this direction but with added value, is this. While exploring the different nuances of sensations, try to find, if it exists, a pleasant or positive component. For example, the patient might initially think, I feel burning, I feel pulsing, then ask, is there any part of this sensation that is pleasant? Often, the assessment might be, yes, there is something pleasant. It's a bit warmer than I expected, but it doesn't really hurt. Plus, it's a welcoming warmth. Similarly, one might feel intense heat, but also that it helps to relax muscle tension. This sensation is particularly easy to experience when submerging the shoulders. In this case, one can find many contrasts. The intense heat on the skin, the muscle relaxing, the warm steam rising from the water and feeling pleasant on the face, except for when it enters the nose and makes breathing a bit difficult. On the other hand, breathing more slowly can reduce the unpleasant effect and increase pleasure. Another interesting step in this neurohacking process involves leveraging the power of contrasting sensations. In nature, it is practically impossible to experience two opposite sensations simultaneously. A stream has a single temperature with small variations. A rough rock will rarely have a smooth strip in the middle. And even if it does, it is unlikely our hand or toe will touch that exact spot. Therefore, if our sensory system detects two opposite sensations very close together, it goes into a crisis, thinking there is a problem and spontaneously resets to determine whether there is a problem or if the external environment is truly discordant or unpredictably variable. In the context of our neurohacking experiment, we can promote this mechanism by, for example, taking the shower head and wetting just one knee or shoulder with cold water. Immediately and for the next couple of minutes, it will be interesting to pay attention to the physical sensations and the corresponding mental and emotional changes. This sensation helps recalibrate perception, but also interrupts any negative mental flows or habits that are not based on the real situation. For an everyday example, during meditation or a conflicting discussion, this mechanism can be exploited by seeking two closely spaced different tactile sensations. One might be touching the boundary between a zipper and the fabric with a finger, feeling the contrast between the cold, hard metal and the soft, warm fabric. Focusing on the boundaries of this perception and what it generates within us can help detach from the difficult moment and refocus on what truly matters at that time. So, this is an exercise in exploring lived sensation. It's a continuous game of feeling, better understanding real responsibilities and cause effect mechanisms, sensing connections between things, experimenting, and experiencing new sensations that are often corrective in relation to how we perceive things and what we think about ourselves. All else being equal, there are differences between bodily areas. For example, the skin in certain places is more sensitive than in others. It may be thinner or have a special innervation. Therefore, it's interesting to explore various areas and perceive these differences. In some cases, not only sensory perceptions change, but also the memories or emotions evoked. For instance, a spot on the back or on the arm stimulated by heat, cold, or a strong jet, like a hydro massage, can evoke feelings of sadness or childhood memories. Managing these aspects goes beyond neurohacking techniques, but interesting mechanisms or somatic memories can be found and worked on with other techniques that we will see later in these and other switch areas. Sometimes, by experimenting and following instinct, patients discover interesting dynamics. For example, when submerged in the tube up to the neck, they might try immersing their head as well. They may be surprised to find a pleasant sense of merging with the water, which could be a regressive fetal experience or simply relaxation from passivity and not having to breathe heavily. Whatever the experience and its possible interpretation, it is important to note it. Invite the patient to accept it as it is, at least for now, and then revisit it for further work later. You can also add other variations, perhaps focusing on more subjective aspects, such as body parts that are painful or not accepted for some reason. Years ago, I worked with a beautiful young girl who had fallen in an accident and had a scar on her leg, which wasn't even that noticeable. But for her, it was hideous and represented her relational downfall. She was so beautiful that no boy would have ever noticed her leg before everything else. And even if he did, he would have absolutely accepted it. But for her, it wasn't like that. Among other things, we worked on her belief that her leg was more sensitive to pain, which led her to constantly pay attention to it and reawaken negative thoughts about the accident and her self image, which she felt was severely damaged. Through this neurohacking exercise, she was able to discover firsthand, literally on her own skin, that the sensation in both legs were the same. Additionally, through various experiments, she was able to once again feel pleasure in that leg, which had long been associated only with negative experiences. In our particular case, we also added work on reprocessing the body map through physical sensations, both from water and, in another context, using the sensations of clothing while moving. She was a girl with many resources and had undergone rapid therapy. so rapid that I had some doubts about its long term effectiveness. When I saw her about 6 months later outside a club with her friends, wearing a very short skirt, with the scar in plain sight, happy and content, I had the best follow up possible. Well, I invite you to try the neurohacking technique we have described within a couple of days, even if you think it might not be useful because you don't consider yourself anxious or don't have the characteristics described in the examples. You'll find it to be an interesting experience in terms of the relationships between physical, mental, and emotional sensation. Similarly, it will be a transformative experience to better understand your reactions and see that you can respond differently, modulating your emotions and behaviors with greater flexibility and a wider range.